My name's Dominic Dwyer. I'm the medical virologist here at Westmead Hospital, and we have the main public health laboratory in New South Wales and have an association with the World Health Organisation in doing influenza research and surveillance. So therefore, with the swine flu outbreak that's occurring around the world, we're involved in testing many of the patients in New South Wales that come from areas where there has been swine flu, and we're doing the development of testing for swine flu here at the moment. So the laboratory is extremely busy working through the samples and so on that have been given to us by the public health units, and we're working essentially 24 hours a day doing that work at the moment. Started off with originally cases being recognised in Mexico and outbreaks of influenza being recognised in Mexico. Then at the same time there were some cases in the southern part of the USA, obviously with connections to Mexico. But as things have gone on over the last 2 weeks or so, particularly with things like air travel and population movements, we're now seeing the virus move around the world. So we've had cases, for example, in New Zealand, in various countries in Europe, an increase in the number of cases, of course, in Mexico, and an increase in the number of cases in the USA. So that really is what is typical of a pandemic. It's got to start somewhere, and then it starts to move out. And it's the speed at which it moves out which is the problem. In terms of trying to control things. I mean, so far in Australia there haven't been cases, but we certainly expect to see cases if the disease continues to pop up elsewhere around the world. The World Health Organisation and the Australian government and so on haven't made restrictions on travel, of course. I think, for example, in Australia people are suggesting that you only go, for example, to Mexico at the moment if you really have to go. People should reconsider their travel. Those sorts of opinions and directives really change day by day as we get information about how common the disease is. I think that sort of thing is very much a movable feast. I mean, first of all, I think people should be vaccinated against influenza. That won't probably protect against the swine flu, but it does protect against the other strains of influenza that we're going to start seeing now as winter comes on. So that's one thing. I think the second thing is that people need to understand the very basic kind of old-fashioned things about infection control, like hand washing, like covering their mouth when they cough, all of those sorts of things. They're really important. So I think if people have a respiratory infection, runny nose, cough and so on, they shouldn't go to work. They should make sure that they're not coughing and so on other people. They should be washing their hands, covering their mouth when they cough and so on. And people who are contacts of someone who's sick should also wash their hands and be careful as well.
Okay.
And it sort of seems obvious that wearing a face mask and so on is a good idea, but the evidence to prove that is perhaps lacking. Certainly in some situations, for example in the hospital environment, we do know that wearing certain types of masks are very important in stopping spread of infections like flu or TB or any other respiratory infection to the healthcare workers. What we don't really know is how useful the masks are in the community. People walking the street with a cotton mask on or something. It's always a bit difficult to know how effective that is. I think that I think the principle would be there are certain countries in the world where it's regarded as good manners to wear a mask if you've got a cough. So for example, if you travel in Japan or other countries in Southeast Asia, often during winter you'll see people walking the streets with a mask on because they've got a cough or a cold and they don't want to spread it to other people. That's not been a feature in Australia at all, but you could argue that that's probably quite sensible. If somebody actually has the flu and you're more than a metre or so away, then you're unlikely actually to catch an infection. The other thing is that they can be spread by if someone coughs on their hands and then they shake hands or they kiss someone or whatever you do, those sorts of things. It can be spread by that sort of contact, if the droplets are on your hand or you blow on your nose and then you open the door handle sort of thing. So that's why the hand washing is important. And the mask use is probably not so relevant if you're more than a metre or so away. So that's why we would say with someone who was sick, well look, go home, don't go to work, because if you're at work and you're coming into contact with people and sharing an office with them or within a metre of them, then you're at risk of catching the infection.
Dominic Dwyer. Is that his name?